Good afternoon, my name is Gloria Gonzalez. I'm a pediatric nurse and I'm currently a DNP student at San Agustin University of Health Sciences. I'm engaged with this project because in pediatric population, starting peripheral IVs takes multiple attempts due to the vessel size, the lack of visibility, and especially because since our patients are tiny and the visibility and also palpation, all of these barriers are affecting the effectiveness in the first attempt when we start IVs. In addition, this is one of the projects that I wanted to work because we wanted to improve the safety of the procedure because this essential skill is impacting different areas in our quality of care. It's impacting timely medications, cost per admissions, shortening length of stay, improvement on the cost of the supplies, utilization of the human resources, patient, family satisfaction, and also nursing satisfaction, among others. In the next few minutes, I'm presenting my project, starting with the description and significance of the problem, the PICOT question, the summary of the search strategy and results, the synthesis of the literature support or evidence for the proposed change, the proposed plan using Carter's model, the database evaluation, the plan for dissemination, the practice recommendation, and the conclusion. I invite you all to please listen to my presentation in the next few minutes. Thank you. This presentation starts with describing the problem. 350 million of peripheral intravenous catheters are inserted in the United States annually. Peripheral IV access in pediatrics is complex. Why? Regularly in pediatrics, according to age, we have little ones with really vessels that the size are so tiny, so little, and it is disposed really lack on visualization of these vessels. And in addition, we have limited palpation, and the assessment of the vein is very complex in order to determine the complexity and the difficulty of the vein access. Multiple attempts for that reason may be necessary in order to obtain a successful venous catheterization. Peripheral IV access is a stressful procedure for pediatric patients, for the family, and for the care provider. According to NICOL 2019, 35 to 50% of the IV placement failures can cause complications. These kind of complications are phlebitis, site infiltration, localized infection, and extravasation, among others. The hospital designated or designed costs for the IV procedures due to the multiple tries and attempts can be increased to a total of 43% of the costs determined by the hospital in patients who are requiring more than 3 attempts. The PICOT question is the population is the pediatric patient 0 to 18 years old. The intervention is the use of the vein visualization device. The comparison is with the standard procedure without the vein finder. The outcome is to increase the success of the attempts in the insertion of the IV placement. That's the outcome, and the time is over a period of 12 weeks. Using electronic search, 3 databases were utilized: Cochrane, PubMed, and Signal. The keywords utilized were peripheral venous catheters, IV access, intravenous access, and pediatric placement. The exclusion criteria were adults and outpatient settings and articles prior to 2015. The inclusion criteria was relevant for age, pediatric patients age 0 to 18 years old in an inpatient setting. The articles selected were from 2015 to 2020. Originally from these articles, I obtained 35 articles in Cochrane, PubMed 71, and Signal 358. Screening the articles, after screening them, 343 were non-duplicate, and applying the inclusion and the exclusion, I have at the end 51 articles retrieved, and from these 15 articles retrieved, applying after the full text screen, 31 articles were excluded, and then during data extraction, 10 articles were excluded, and I end having 10 articles included. The evidence by Kagler shows that first attempt success rate was 46% with an average of 2 attempts and a length of 20 to 30 minutes. For CAR, the transluminant and the infrared success first attempt both displayed more than 80% of effectiveness in first attempt. The mayor, in a study in 2017, reported the first attempt was significantly higher with a 95.8% success per difficult veins graded. In the same author, Demir and Einal, in 2018, they reported a peripheral venous catheter placement success in rates in pediatric patients 0 to 3 years old as 74.1% compared with control group that was 40.7%. Goff, he reported a resource utilization where 37% of the annual cost of a 30-bed unit was utilized in multiple IV attempts. Gillion reported a vein visibility that was increased in difficulty vein access, and so she reported the first attempt success rate of 93%. This project is using the Carter's model of change. The first step is to create a sense of urgency. It's vital to use statistics from patient satisfaction, nursing performance, cost, and safety. The second step is to build a guidance coalition. It's essential that nurse managers, assistant nurse managers, charge nurses, and staff are engaged. In the third step, to develop a change vision requires to determine the change and the strategies. The fourth step is the communication of the vision, how, using the shared governance, planning meetings, daily energizers, continuous emails, and communication. The next step is to enable action, empowering team members, providing autonomy to act. How? By educating how to use the visualization technology, educating the patients, and implementing the vein visualization technology. The next step is to generate short-term wins, recognizing the good input from the individuals. The next step is to sustain acceleration by endorse and maintain change, maintain the visualization device in perfect condition, providing consistency in the equipment maintenance, charging, cleaning, and disinfection, and also to continue with training if it's necessary. And the last step is to institute change, how to create a team culture towards the new change. The first measurement is the average of number of successful attempts in peripheral intravenous insertions. The tool is the electronic medical record available in our organization, and the information that I'm looking for is how many attempts per successful IV, and if the visualization device was used or not. The t-test will be used to compare pre and post measurements and percentage. Results, I'm looking for increase of the first attempt success rate. The second measurement is the average cost per intravenous insertion per attempt. The tool is the unit database related with cost analysis. T-test will be compared pre and post measurements, and the results are to determine the cost per attempt and cost per successful attempt in 90 days. The third and last measurement is the length of time to successful IB placement and the number of the attempts. The tool surveillance to determine the length of time per successful IB. Correlation coefficient P, and the results are to reduce the time for the procedure. The plan for the dissemination of the evaluation of the evidence-based project change includes different institutions, some of them locally. So locally will be the hospital through the Chair Governance Committee, the Educational Department, the Safety Committee, and through pediatric leadership team and the key stakeholders. Just more national and international. National could be Sigma Theta Tau, infusion therapy NURS, and publications could be infusion therapy nursing journal, Journal of Pediatric Nursing, and Pediatric Emergency Care Journal. The use of the visualization device reduces the time of operation, increases the first attempt success, and decreases the number of attempts of the IB access insertion. In addition, this adopting the visualization technology devices as part of the routine procedure used by nurses during the assessment and selection of the peripheral IB site help by detecting the vessel and aiming the procedure towards success of the peripheral IB catheterization. In conclusion, the pediatric peripheral IV success are increased by the use of the visualization technology. The evidence shows significantly that the success in the first attempt is increased using the visualization technology, the procedure time is decreased, and the attempts are decreased. The steps to create this climate for change are based in Cutler model of change, and in this way the organization are engaged and is able to implement and sustain the change. The intervention is the adoption of visualization technology devices used by nurses during the assessment, selection, and detection of the vessel, and aiming the procedure towards success of the peripheral IB catheterization. The dissemination will be spreading the word by many routes, and the conclusion is that the using technology visualization devices as part of the nursing routine will support the success in the first attempt and the time reduction of the procedure and the success of the IB procedure. If you have any questions, please let me know. Thank you so much for listening to my presentation. If you have any question, please let me know. Have a wonderful evening.